For each patient, we talk about what their goals are for the birth control and what they hope to get out of it beyond just not getting pregnant, because some methods are better for making their periods better. Some women are able to take a pill every day and they like doing that. Other women can't remember that, so we have to come up with another option that's better long term for them. Also, whether or not they are planning to get pregnant anytime in the future, or maybe it's a year from now versus 10 years from now. There are many different methods of birth control. There are completely non-hormonal methods. There are methods as basic as just tracking cycles and knowing when you ovulate and avoiding intercourse at those times. There are methods such as condoms, male and female condoms. There are spermicides, cervical caps, diaphragms. There are various methods that are completely non-hormonal. And then there are hormonal birth controls, and there are even several different variations to that. There are methods that have both estrogen and progesterone in them. That would be most of the traditional birth control pills, the birth control patch, and the NuvaRing, which is a vaginal ring. Those methods are all helpful with keeping periods lighter and less painful and more predictable, so you know when your period is coming. There are also methods that are progesterone only. Some women can't take estrogen, so they can't use any of the methods with estrogen. So there are methods such as a progesterone-only birth control pill. There is the Depo-Provera shot, where you get a shot every few months. And there is a birth control implant that goes in the patient's arm and is good for 3 years. And then there are the progesterone IUDs. There are several of them on the market. They can be 3 years or 5 years. And IUDs are little T-shaped devices that we insert here in the office. They sit inside the uterus and they keep you from getting pregnant. There's also a completely non-hormonal IUD as well. So we have many different options that can fit each woman's individual needs. And so in deciding which method is right for you, we would go through your medical history, your personal history, and see which method might fit best for you. Obviously, not all methods are even feasible for all patients. We would go through all of the options and kind of determine what the goals are for each patient and tailor the correct therapy to her.